Hi, I'm Susan Williams. For the next half hour, we are going to focus on 3 important health topics affecting thousands of local residents here in Tampa Bay and give you some practical, actionable items that will help you take action for your health.
We will go behind the scenes at Florida Cancer Specialists and look at the latest innovations in cancer care with a focus on patient-centered care that is a far cry from the one-size-fits-all cancer care of the past. Then we'll focus on your oral health on location in Lakeland, Florida, with the experts at Florida Dental Implants as they focus on the dangers of periodontal disease and what you can do about it. And we begin with a trip to the ER with the amazing team at Florida Hospital Tampa and explore why seeing a doctor first has huge advantages.
Florida Hospital Tampa emergency room doctors see over 70,000 emergencies a year. That's why Florida Hospital Tampa's new Doc First ER is making a difference in the lives of patients and families in Tampa Bay. Since the new ER opened its doors last year in November of 2014, thousands of families have experienced seeing the doctor first. Not only is this a new reimagined way to deliver emergency care, it comes with less stress and more attention to your needs.
I spoke with Dr. Wenzel Tierheimer, who was one of the ER doctors caring for patients at Florida Hospital Tampa. He explains how the new Doc First method compares to the average ER visit patients may be familiar with.
In the typical emergency department, you'll walk into the waiting room where there will already be a bunch of patients waiting to get called back into the ER. You'll walk up to a window and write down your name and chief complaint on a sign-up sheet, and then sit down and wait to be called up. You'll get called up to see a triage nurse and then a registration clerk. You'll go sit back down in the waiting area again. And then after more waiting, you'll get called back into the emergency department to your treatment room, where you'll be seen by a tech and a nurse. You'll wait more, and then you'll be seen by the emergency physician, who will then order all the appropriate tests and medications. So the Doc First method turns the whole process upside down. Instead of seeing the doctor at the end of the encounter, you see the doctor first. It's been a huge satisfier, and not only the patients love it, the physicians love it too, because not only does it improve the patient experience, it also improves the patient safety. ER visits are often filled with a lot of anxiety, and it really does decrease the patient's anxiety level greatly to be able to see a physician right away. In addition, it's really nice to have the patients be able to see me first, because very often it's difficult to determine if the patient has an urgent medical condition or if they have one of those seconds to minutes emergencies where every minute counts. And it's really wonderful to be able to identify those patients right away when they come in.
But it's not only a new approach you'll find at Florida Hospital Tampa. You'll also find a new state-of-the-art emergency room as well.
Our new emergency department opened the first week of November, and it doubles the size of our old emergency department. Florida Hospital made about a $55 million investment in the community in building our new emergency department. We have 48 private patient rooms with an adjacent 12-bed observation area. We have our own dedicated ER radiology area with our own CAT scan, digital x-ray, and ultrasound. And we also have dedicated pediatric rooms.
The new ER was designed specifically to provide the highest level of care with less waiting and less stress.
When you come in through the ambulance entrance, our big resuscitation suites are right at the ambulance entrance. So the sickest patients can get put in a room right outside of the ambulance bay. In addition, scattered throughout the emergency department, we have isolation rooms for patients who have infectious diseases as well as those with compromised immune systems.
A trip to the ER can be especially stressful on children, but Florida Hospital Tampa thought about that too.
So in our pediatrics area is staffed by a pediatrician, and all of our pediatrics rooms are filled with something called the Philips Ambient Experience. So they're soft, relaxing lights, nature scenes that get projected on the walls, and relaxing sounds. And these serve to decrease the patient's anxiety and pain levels and actually decrease the amount of pain medication patients need.
There is also an ICU tower located above the ER.
The critically ill patients are the ones you want to move around the least, so it's really nice to be able to just load them into an elevator and have them come out and be able to enter their room without a prolonged transport time.
The new Doc First method is getting great response from patients.
We do get feedback from our patients after they leave, and universally the Doc First process has been very popular. When I've seen patients out in triage, they've seemed really happy to see a physician right away. And for example, the chest pain patient, when they find that their EKG looks normal right away when they walk in, it's a big anxiety reliever. And so I think patients are really happy with the process.
Clearly, the patients love the new system, but how did the staff react to this upside-down method?
Well, initially there was a lot of discomfort with changing something that we've always done, but when a system works the way Doc First does, people begin to embrace it. So everybody that works there is really excited about the process.
Dr. Tierheimer explained how it was patient feedback that prompted these changes.
Well, we actually listened to what our patients wanted. They did some market research and found out that this is what patients really wanted. And after looking into it, it ended up seeming like a really good idea. And when patients get what they want, they're easier to treat, they're easier to care for.
Florida Hospital Tampa is located on the corner of Bruce B. Downs Boulevard and Fletcher Avenue. For more information, log on to docfirster.com. Did you know Florida Hospital Tampa's new Doc First ER has a new ambulance bay that accommodates up to 6 ambulances at one time if needed? Up next, we'll show you how Florida dental implants are improving lives in just one day.
Physicians Corner, brought to you by Florida Hospital.
While you never plan for an emergency, we do. Florida Hospital has 5 emergency rooms across Tampa Bay, including a brand new one here at Florida Hospital Tampa. Knowing when to go to an emergency room can save your life. You should seek immediate medical attention if you experience any of the following symptoms. Chest pain of any kind, even if you think it's only heartburn. It could be the sign of a heart attack. A persistent pain that wakes you up or you can't sleep through. Any loss of sight, speech, or the ability to move, as these could be signs of a stroke and should be diagnosed right away. All of our ER doctors are board certified in emergency medicine, and they are available to see you 24 hours a day.
To find a physician or to learn more, visit floridahospitaler.org.
Have you ever heard the phrase, smiling makes any face beautiful? Unfortunately, there are many people who don't dare to smile because of what others might see, and it has a huge impact on their quality of life. Here at Florida Dental Implants and Oral Surgery, we'll show you how they are transforming lives in just one day with new teeth now.
These are just a few of the amazing transformations performed at Florida Dental Implants in Lakeland. Their team of over 50 specialists change lives every day after pioneering and perfecting the New Teeth Now procedure. Dr. David Kirkpatrick shared with me how periodontal disease is one of the major reasons he sees patients in his office.
Well, with periodontal disease and tooth decay, they're 2 diseases that pretty much a lot of people have. Most people really don't even know that they have them. They can be, painless, especially the periodontal disease. And a lot of people, from neglect, from going to dentist for various reasons, either being scared or access to care, whether it's where they live or finances. Seems that people will see their primary care physician a lot. They're more apt to have physicals every year for their body but somehow their mouth gets neglected. So it is really important, just to have somebody to do like a physical in your mouth to see if you do have tooth decay, if you do have the early forms of periodontal disease, which usually starts off as just red or inflamed gums.
Every time I went to the dentist, it was always about, well, we can't really work on your teeth, your gums are bad, your teeth are mobile. You need deep root cleanings every 6 months. It's when I turned around and looked at my husband and I said, we got to make this happen.
So, what are the signs of periodontal disease?
Well, with the more advanced stages of periodontal disease, where the bacteria actually starts to melt away or eat away a lot of the bone that supports the teeth, when that happens, the gum will follow. So it'll look like there's a lot of recession of the gum tissue around the teeth. So you start to see some of the roots of the teeth. The teeth can become mobile. You can actually have some, almost like pus, some pus draining from around the teeth. So there's kind of levels of periodontal disease where you can get from really severe periodontal disease to just the bleeding, irritated gums.
Many may not realize that severe periodontal disease may affect more than just the teeth.
When we see patients with severe periodontal disease, they do have other medical issues. Some are related, some are not, but a lot of times people complain that they're tired. And we don't really hear about that until after we've treated them. And then they come back for their follow-up visits and they talk about, well, I didn't realize that my teeth had that much effect on my body, that they feel 100 times better than they did before they had their teeth out or the periodontal disease treated. Even patients who have diabetes have a really hard time with a chronic infection anywhere in the body, and especially the mouth, that controlling their sugar levels and kind of keeping them at a constant level that their physician is happy with, it's a lot easier for them to do that after the periodontal disease is treated.
Florida Dental Implants has performed over 15,000 implants and sees many patients who have been turned away from other dental surgeons.
Yeah, a lot of the patients that we see, either they've never been to a dentist and they think that dentures are their only option, or we see patients who dentists have pretty much told them that they weren't candidate for implants. And with the technologies that we have now, like the CT scans, and even just good clinical exams, most patients, actually I've never had a patient that was not a candidate for implants.
It's hard to imagine these dramatic transformations take place in just one day, but that is what is so appealing to patients.
A lot of the patients, when we see them for consult and we listen to them about maybe why they've neglected their teeth and why they've avoided going to the dentist, a lot of people are just scared to death of the dentist, and a lot of people they feel like they don't have time in their life to go to the dentist. So when they hear that they can have all of their teeth taken out, implants put in, and new teeth placed in one day while they're asleep, it's a big advantage to a lot of patients, because they can get back to their life a lot quicker and they can have everything done while they're asleep, which makes it a pretty easy treatment overall to go through.
Dr. Kirkpatrick explains how they are able to do it all in one visit.
Having the in-house lab here at the office, having our anesthesia team and our surgical assistant, kind of their team, at the end of the day, they all work together as a unit to allow patients to come in at 7:30 in the morning and leave that afternoon totally transformed, so they can get back to their life with new teeth, new outlook on life, able to eat what they want and not really be embarrassed about how their teeth look or their appearance.
Their patients couldn't be happier.
I woke up from the surgery. My husband was right there with me. I got to have a little ice cream, which was cool because it was cold and I could do it. And then I went home with a brand new smile that very same day. I took my first selfie ever in my life in the parking lot of Florida Dental Implants the day of the surgery.
So if you've been told you're not a candidate for dental implants, Dr. Kirkpatrick has some advice.
Anybody that's thinking about this, or anyone that's been told by another specialist or another restorative dentist that they're probably not a candidate for implants, I would urge you to come in so we can do an exam, get a CT scan, and determine how we can get you to your goals.
Florida Dental Implants and Oral Surgery is located in Lakeland. For more information about the New Teeth Now procedure, log on to newteethnow.com. Did you know? According to the CDC, half of Americans aged 30 or older have periodontitis, the more advanced form of periodontal disease. This equals approximately 64.7 million Americans. When we come back, I sit down with Dr. Wade Weaver at Florida Cancer Specialist, who shares the latest advancements and approaches in cancer treatments.
Have you been self-conscious about your teeth for so long that it's almost become unconscious or automatic? Standing in the back row when it's time for pictures, or covering your mouth to hide your embarrassment? At New Teeth Now, we want something better for you.
Since the New Teeth Now procedure, everything has changed for me in so many ways. I took my first selfie ever in my life in the parking lot of Florida Dental Implants the day of the surgery. You can't keep me out of the photos now.
New Teeth Now from Florida Dental Implants is a one-of-a-kind restorative dental procedure. It's given thousands of people their confidence and their smile back in just one day.
I can just smile and be myself and just exude the confidence that I have.
At Florida Dental Implants, our team of over 50 specialists are committed to help you get your smile back all in one day.
With my new smile, the sky's the limit.
Call now for our limited time summer savings or visit newteethnow.com today.
There have been some tremendous advances in medicine in the past few decades. Today, more people are surviving cancer than ever before, thanks to some major breakthroughs in cancer research. For more than 30 years, Florida Cancer Specialist and Research Institute has been committed to world-class cancer care right here in our community.
To help us better understand the ever-changing landscape of cancer treatment, I sat down with Dr. Wade Weaver, a medical oncologist with Florida Cancer Specialist, to discuss how a diagnosis of cancer has a much higher survival rate than in the past.
Well, a diagnosis of cancer can mean a lot of things, anywhere from a non-melanoma skin cancer that can be easily treated with freezing it or removing it, or it could mean an advanced solid tumor malignancy that carries with it a very short prognosis and lifespan. So there are a couple of reasons why there's better survival with cancer nowadays. One, we're picking up cancers at an earlier stage. We have better screening and detection methods. When we can pick up cancer at an early stage, we're able to offer more curative therapies, for example, surgery to remove it, etc. The second reason we're seeing longer survival is we're seeing an advance in the therapies. Again, they're more targeted in their approach. To use a military analogy, rather than dropping a bomb on the entire town where you kill some good guys and bad guys, we have some laser-guided missiles for the bad guys now. And so we have therapies that target the cancer cells with very little collateral damage to our normal tissues. And so this leads to these treatments working better, being more effective, and also better tolerability for the patients. And so they're able to stay on them more long-term.
Cancer treatment is no longer a one-size-fits-all. Personalized medicine is now a common approach in cancer treatment.
Nowadays, we're able to identify unique characteristics of a colon cancer, for example. What allows those 30% of patients to respond to the drug? What was unique about those patients' colon cancer that responded to this drug? And so going forward, we can try to select patients who have those unique characteristics and only use that drug in those patients, and try to explore and find something else for the other 70% of patients who do not benefit from that particular drug. So for example, at Florida Cancer Specialist, we have a number of clinical trials that are targeted in just that way, trying to find patients who are uniquely qualified to receive a certain drug that we feel have a better chance of responding to it, not just a haphazard trial and error coin flip, but rather a very educated approach, more advanced approach to selecting the chemotherapy drugs for a given cancer.
You may not be aware that Florida Cancer Specialist has unequaled access to national clinical trials for adults.
There are a handful of malignancies where we've identified sort of an Achilles heel for the cancer that we can target. It's an extreme weak point of the cancer, if you will. And by designing a drug that targets and seeks out that Achilles heel, we can cripple the cancer. And so we've taken some cancers that in the past have felt to be incurable. I don't know that we're prepared to say patients are cured yet, but we're certainly see them go out a number of years without any active disease on a very tolerable therapy. And we certainly begin to ask that question in some patients, are they cured?
Dr. Weaver explains how these trials are very important in the fight against cancer.
Well, I think many patients at the outset, when they hear the notion of clinical trials, they feel like they're going to be used as a guinea pig, or this is some concoction someone's mixed up in their garage and wants to try, and that's not the case at all. This is cutting-edge, advanced opportunity to receive the drugs of the future. So all of the chemotherapy drugs we use today were studied in a clinical trial, yesterday. And so an opportunity to get a drug that's being experimented and being researched and has shown some promise in this particular tumor is a very unique and fortunate opportunity. Many of the trials include the current standard of care, and so patients are not disadvantaged in any obvious way by going on the clinical trial, but they have the potential opportunity to receive an additional agent which has shown some real promise in preliminary studies. And these are the drugs of the future. These are what will become the standard of care in the future, and it offers a unique opportunity to gain access to them today.
That research is already reaping rewards.
So, for example, there was a new drug recently approved by the FDA for the treatment of lung cancer, and this is a drug we've had in clinical trials at Florida Cancer Specialist for some time. In fact, we enrolled 100 patients on this clinical trial. So in the short term, we've seen tremendous dividends on enrolling patients on this trial. Not only did those patients benefit from receiving this drug they otherwise could not have received, but their participation was very philanthropic. It led to the research that led to the FDA approving this drug to be used, so now that it's available to all patients across the country.
Dr. Janelle Park is one of Florida Cancer Specialist radiation oncologists. Advancements in radiation oncology have doctors excited about how it is improving cancer treatment.
When you look at the overall evolution of the utilization of X-rays in medicine, it actually started off with Conrad Röntgen, who actually came up with the whole idea of X-rays, and there's this very famous classic picture of his hand with the ring being X-rayed, and that used to be the first X-rays that we found. X-rays have actually been utilized for cancer treatments for basically over 100 years, but you're right, our ability to have better technology, deeper penetrating X-rays, and actually to be able to pick out certain areas that we want to target and really minimize the dose to the normal critical structures that are adjacent to this target and minimize side effects, both acute as well as late, has really progressed phenomenally, especially in light of our technology advances in terms of computer advancements. We are very heavily dependent on computers and also CAT scan imaging.
An example of this type of radiation is treatment for breast cancer patients using prone breast radiation.
This is actually, even though the system that we have is relatively new, it's not a relatively new thought process, because ultimately the classic way that we treat women with breast cancer is to have them on their back, or what we call a supine position, with their arm above their head. For a majority of women, this can be beneficial, but women with larger breasts that tend to move laterally, in order to incorporate all of that tissue into your radiation field, you have to kind of account for that, and you start taking more of the normal tissue, which is predominantly lung and on the left side underlying heart tissue. For patients that weren't that mobile historically, they've actually been treating patients in what we call the lateral decubitus position, or kind of on the side. And really, I think it was just kind of a progression of thought that really allowed us to move to the prone breast treatments. This has actually been around for a number of years already, but the systems, again, just with technology and our improvements of our ability to really make things better for our patients, has really made the system that we currently have phenomenal. It's actually integrated into our tabletop. It's a carbon fiber table, so you can actually treat through the table itself without having any of what we call kind of a scatter effect or an increased buildup of radiation at the surface, because it's already traveled through a different object before entering the patient's body. And really with the prone breast treatments, not everybody's going to be eligible, but for those patients that are, it really is beneficial in terms of decreasing the underlying lung as well as heart dosage.
But cancer treatment today is not just about chemotherapy and radiation. It goes a lot further.
Not all of the focus, the treatment of a cancer patient is focused on their cancer alone, but managing the patient as well. So at Florida Cancer Specialists, we offer a few different avenues that we can address that. Acupuncture, nutritional therapy, massage therapy. These are all different avenues that we can use to address the patient and some of the side effects they're having from some of their treatments, some of the side effects that they're having from the disease itself, and just trying to manage the patient in totality, not just a purely cancer-directed focus.
For information on Florida Cancer Specialists and to find one of their 90 cancer treatment centers across the state, log on to flcancer.com. Did you know? Cancer actually refers to more than 200 separate diseases, all characterized by DNA mutations in the cancer cell that causes uncontrolled growth.
Founded in 1984, Florida Cancer Specialist and Research Institute is the largest privately owned independent oncology practice in the United States, with nearly 500,000 patient visits annually.
The 5 years I've been with the company, we've grown from nearly 50 physicians to 180. We hope to continue to grow by, leaps and bounds into the future, which is providing world-class care and keeping patients in the community where they live.
President and founder Dr. William Harwin attributes much of the success of the practice to its unequaled clinical trials research program.
The clinical trials have always been extremely important to me. It's one of the most important things. And the jewel of the clinical trial program is our phase 1 program. That is such an awesome addition to the practice. It's wonderful to be able to give patients that alternative. That's one of the things that sets us apart from anywhere else.
Florida Cancer Specialist, online at flcancer.com.
Thank you for joining us today. We hope you have learned how new approaches and advancements in healthcare can help you take action for your health.